Hello everyone, today is September the 23rd. I'm Dr. Adam London, Director of the Kent County Health Department. As of yesterday, we're reporting 8,745 diagnosed cases of COVID-19 here in Kent County and 7,466 recoveries. We've been seeing an average of about 55 cases per day over the course of the past week, which is again is a little bit of an increase over the previous week. We've seen this now for 3 or 4 weeks in a row where we're seeing slight increases in the number of cases week over week. That's not a terribly surprising reality given the fact that we have some risk increasing factors right now. We have schools coming back together. We have the change in weather that is bringing people inside more. And so it's not a surprise that we're going to see these numbers creep up a little bit. The key is we want to see them stay within a manageable number. Our positivity rate is 2.9% for the past 7 days. Again, that's an increase. I think last week I reported 2.4 or 2.5%. The week before that was at about 2%. So it has gone up almost a full percentage point over the past couple of weeks. That's something we're watching very carefully. We want to make sure that positivity rate stays below 4%. And right now we're at 164 deaths here in Kent County in total from COVID-19 during the course of this pandemic. We've had 1 death reported to us in the past week. Lots of questions about schools and how the reopening of schools is going. We continue to see in the K through 12 environment a few cases here and there, not surprising. We have not seen any large outbreaks in schools to date. That's very encouraging. It's very positive for us that we've been able to identify a number of cases very early on before they erupted into a cluster or an outbreak that could affect an entire school. So for the most part, we've seen small numbers of cases that we can isolate, quarantine those close contacts, and school could continue. The university situation, as you're aware, following the news, a lot of cases at Grand Valley over the past couple of weeks. That seems to be stabilizing. Tremendous work by our friends in Ottawa County and at Grand Valley State University in doing their part to reduce risk, keep the learning environment going, but really trying to encourage these students to avoid social gatherings, to avoid unnecessary travel, and making it difficult for the virus to spread. So great work is happening there, and we really encourage people, whether you're in school or anywhere in our community right now, we all need to do our part to continue to make it difficult for this virus to spread. And most importantly, the things that we've learned that are effective in doing that are wearing facial coverings as much as possible when you're in a public space. Social distancing, making sure that wherever you're at, you're maintaining that halo of 6 foot distance between you and other people to avoid the sort of crowding that is conducive to allowing the virus to spread from person to person. And then hygiene. We've talked an awful lot about hand washing and hygiene over the course of the past 6 months. We need everyone to continue to do a great job with hand washing and wiping down common contact surfaces to make sure that that virus isn't spreading from person to person through those common touch points. Also wanting to encourage people to stay home if you're sick. I know we've talked about this an awful lot, but we continue to see instances where virus is spread because people assumed that it was just a cough or just a cold, and they went to work and gave it to other people, and that's something that's so avoidable. So if you are sick, stay home, and we know that the symptom profile for COVID-19 is so broad, it makes it difficult for us to know exactly, for people to know exactly when it's COVID versus the cold or allergies. We know that COVID can manifest itself with a cough, sore throat, fever, difficulty breathing. Certainly if you have any of those symptoms, stay home, call your doctor's office. But it can also manifest itself with diarrhea, with loss of taste, with body aches. And so there are many symptoms associated with COVID-19. If you're feeling any of these things, stay home, call your doctor's office, and get tested if appropriate for COVID-19. I want to also continue to encourage people to work at home for as much as possible. That's going to be important as we go through these winter months. until we get to a point where we have herd immunity, empowering people and encouraging people as much as possible to work virtually, to work at home. We do these things along with staying home if we're sick, wearing facial coverings, social distancing, and using proper hygiene, and we can lower the risk for our entire community. And by doing that, we can continue to allow things like schools to reopen, making sure that kids get the education that they need. Also want to encourage people to be mindful of the situation that we have right now with EEE, that's the Eastern Equine Encephalitis, and the West Nile virus. We always see late in the fall or late in the spring and early fall an increase in risk for these two viral infections. They are two very serious infections which can cause death or serious harm to people. They can also be avoided by avoiding mosquito bites. I know that's difficult, but wearing a DEET-based repellent, wearing long sleeves, long pants when outside, and trying to search the property for small containers of water. Maybe it's cans in the bushes or a bucket or kids' toys somewhere in the backyard, and dumping any water that may be contained in those things out. It doesn't take much water to provide a good habitat for mosquitoes to breed, and by dumping those out, we can avoid the next generation of mosquitoes and hopefully get through the next month or so without many more cases of EEE or West Nile virus. So please do these things. Let's make it a healthier, safer fall for everyone. And I encourage you to stay positive, stay healthy, and I'll talk to you again very soon. Thank you.